Okay, welcome everyone to the NEWaukee Cloud Cafe. Thank you for joining us today. We are going to have a cafe conversation, which is one of our many programs that we do on the Cloud Cafe every week. You can sign up for the NEWaukee newsletter at NEWaukee.com if you want to get a full schedule of all the programs we're doing. The programs that we do on the Cloud Cafe are brought to you by Ginger Lazovik at the great Shorewest Realtors. They are supporting all of our online content, so big thanks to them. That makes all these programs free. Love what they do there, and if you want to check Ginger Lazovik out at Shorewest, she's our kind of resident expert on housing on some of our programs. So today we are joined by Coreen from NEWaukee Health, and we are going to talk a lot of things, but I want you to first introduce yourself, Coreen. And how you doing?
Sure,
Welcome
Coreen.
to the show.
Thank you. Thank you for having me, Jeremy. Coreen Dicus-Johnson. I'm President and CEO of NEWaukee Health.
Okay, welcome. So let's get right into it. And let's just start with, maybe there's a lot of people joining us. And what I could see from some of the people that are joining us today, it's kind of all over the state. So just want to give everyone a rundown, if they don't know what NEWaukee Health is, to tell us what the mission is and what the company does.
Great, thank you. NEWaukee Health has been around for over 35 years. We are a Wisconsin-based health insurance company. We've always been provider-owned. We were started by a group of physicians in the Fox Valley, and now we are owned by two great high-quality healthcare systems, Ascension, Wisconsin, and Freighted Health System. And our mission really is to support our communities towards health and wellness. And so everything that we do, we put our members at the center of our decision making, focused on bringing in physicians into that process to ensure an excellent experience for our members.
Awesome. And kind of tell us your journey. Like, how did you get to become CEO? You know, what was your story before this and led to this company, and some of your trajectory and maybe some of the stories along the way?
Sure. So I'm an attorney by training. I started in the health insurance industry as a staff attorney for a large publicly traded insurance company here locally in Wisconsin. And if you would have asked me when I went to law school, would I have saw myself as a CEO of a healthcare or being in healthcare in general, I would have said, no, I love the law. I want to stay in the law. But through the years being an attorney, one of the things that I discovered is that, you know, our job as lawyers is to clean up other people's messes. And I felt like that, you know, the guy following the elephant in the parade, cleaning up the messes, and I really decided that, I think it would be more fun to lead the parade, be the drum major. So when the opportunity presented itself for me to become someone in the business side, I left the practice of law, and I worked in various areas of this insurance company, leading government programs, leading other type of compliance, contracting, and such, more the business side of things. And really enjoyed taking all of my experience as a lawyer and issue spotting and thinking differently about the business of insurance. And when the organization that I was working for was acquired by a much larger publicly traded company, I saw the opportunity to make a change. And so then I went over to the health and provider side. I worked for almost 11 and a half years for Wheaton Franciscan Healthcare. Now it's part of the Ascension family of ministry. And I did all kinds of work there. I started off in contracting. I ran the medical group in Milwaukee, ran revenue cycle. But my last role was as a market president, where I had 3 hospitals that I was the leader of, and the medical group that supported it. It was a very, very rewarding experience. Matter of fact, it really changed my, if you will, my purpose for work. Working in a mission-oriented organization. And even though I personally wasn't administering health care to individuals, I knew that the work that I did had an impact on our patients and our community. And so when the opportunity came for me to work at Network Health and lead the organization, quite frankly, I saw it as just like the perfect culmination of my past. I had the health insurance experience, the provider experience, the fact that we're a provider-owned health insurance company working very closely with the providers of healthcare. It was an awesome opportunity that I took advantage of, and been leading Network Health now for about 3.5 years. It's my dream job. I love it. I love our team. I love the work that we do. And I love the fact that as a Wisconsin company, we are mission focused. Our shareholders, our stakeholders are our members. They're not, the publicly traded aspect of things. We give back to the community, and there's nothing wrong with that model. It's just that for me, after experiencing being a part of a mission, Catholic sponsored organization, to be able to take that experience and employ it at a health insurance company really makes a huge difference for me, both personally and professionally. And knowing that when we do well, when we have profits, we can put those profits back into the communities via our Freighted Health and Ascension. And so that makes me really proud of the work that we do at Network Health.
And I have a follow-up question to that, but first I'm going to launch polling for everybody that's joining us. If they want to fill out some of these questions that we have prompted you, we can read some of those at the end in the responses. So the follow-up question to that is for people that might not know, what's an advantage of being a provider, provider in the health insurance space, provider owned compared to the opposite?
Great question. Thank you for asking. I think the distinction is that when you look at how healthcare is provided and paid for, generally you've got, the payer side and the provider, and there's always this tension about what gets covered and how do things get paid for, and what's, quite frankly, it's that sometimes it's a win-lose kind of situation. What's great about being a provider-owned plan is that we're all part of the same team. Our successes are also the successes of our providers and vice versa. Our providers are part of our decision-making in terms of what should we cover, how should we cover things, how do we go about making those decisions. And if you'll indulge me, I'd love to just tell you a quick story about how this is illustrated. So early on in my leadership at Network Health, we had a situation where a member kept showing up into the emergency department and kept getting admitted. And, in the insurance parlance, you're going to pull one of those claims, you're going to look at it and you're going to say, does this patient continue to need to be inpatient? And, in some instances, those claims are denied for more information. But what's different about what we did is we had our medical director take a look at this, and then he got in his car and drove over to the hospital, sat down with the vice president of medical affairs. They pulled more medical records to say, not should we pay for this, but answer a better and deeper question. And that was, why is this patient continuing to show up in the emergency department? And why is this patient getting admitted? And here's what they found out. This patient was on a drug that was very expensive. And when the patient couldn't afford the drug any longer, he would go to the emergency department, get admitted, and those particular drugs were administered inpatient at a much higher cost. So when they identified what the root cause was, brought our pharmacist in, pharmacist worked with the primary care physician to find another drug, considerably less expensive, that helped that particular member patient to stay on their drug and stay out of the hospital setting. That story for me illustrates the distinction between us and others. We have the luxury of being part of the same team, that we can answer the deeper question of not whether something should be paid for or not, but why is this happening? Get to the root cause, solve it, And this particular member patient is having a much richer life because he's able to afford his medication and stay out of a hospital setting.
That's great. And I could just tell by the passion. And just so everybody knows, I came into your office, well, when you could actually come into people's offices a while back, and I could just kind of feel the difference your leadership has, and it was just kind of refreshing to sit in that room and hear some of your ideas and the passion you have for what you're doing. It kind of rubs off on people. And I want to kind of talk about the workplace culture a bit. Because some of the polling questions we had were around how people are feeling to come back to work and what is the corporate culture like. Can you just take us in maybe before COVID, what it was like to work at Network Health and what the culture is like, and where do you see that carrying over and the changes that will inevitably come out of COVID?
No, great question. So we work really hard at Network Health to ensure that we are taking care of our employees, that they feel engaged, that they feel cared for, because we know that if they are feeling that from leadership and belonging to an organization that cares about them and their families, they are going to want to care for our members. So not only is it the right thing to do for your employees, but it's the right business model because it translates to our members. And so we work really hard at making sure that we create opportunities for advancement. We call it the internal resume. How do you build that? How do you get involved in other projects to be able to build your knowledge, skills, and abilities? Quite frankly, I take somewhat of a nurturing approach. I call it the work family. I really want people to be excited about the work that they do and who they work with, right? And, I get excited. I love to be able to go to work. One of my favorite things is to round. I'm not quite sure what that's going to look like after COVID, but walking around, seeing how people decorate their cubes and what are their stories, what are their families like. We have a lot of engagement activities that we have at Network Health. And one of the ones that I lead that I get just immense joy is the CEO book club. We created a book club, I guess it's been about a year now. We choose a book and we have people sign up, and what we do is, and they're not business books per se, but there's usually a way to tie the message from the book into the work that we do. But inevitably, we learn about each other as people, and as through the reading and the sharing of what touched us about the book, what did we learn. And our culture at Network Health is a place where we can come together, we can share our talents, we can feel like we're part of a bigger purpose, and we can do purposeful work. And I do think that it has resonated with our organization. We do surveys and we perform extremely well. We're always at the 80th plus percentile in terms of employee engagement. And so we hear directly from our employees that they do feel that they're part of this culture that really wants to take care of them. And actually it really served us well, and we're seeing it during this COVID time. So, and we like any large company, you do business continuity planning, right? You want to make sure that if something happens, in Wisconsin, we planned for snowstorms, right? Couldn't get to the office, things of that nature. So we had been planned. We were able to get 100% of our employees in a safer at home environment without 1 second of disruption to our members. And how our culture played out in this is the number of positive comments, not just internally, but things that people are posting on Facebook. They have felt cared for. They felt that their employers, the organization, wanted to make sure that they were safe, that they had all of the equipment to be successful in their jobs at home, to be able to answer the questions, because we do constant communication, so that they could be successful in making sure they answer the questions of our members. And the notes that we've been getting back, what it says to me is that the culture that we have at Network Health, both when we're in the building and when we're outside of the building, has transferred over into this environment, and our members and our providers are benefiting from it.
I just love the attention to culture. I think, sometimes you hear people talk about it, but it's more, they don't practice it as much. And it's refreshing to hear it come from the top as like a core factor of the business and how it operates. It's something that you don't hear a lot in the general area. So if you mentioned COVID-19, obviously your response and stuff like that, and that's been pretty crazy. What impacts has this had on the insurance industry? And then where do you, coming out of it, how do you see the insurance industry changing?
Great question. And this is probably one of the most pervasive and dynamic changes. So, initially, the insurance industry and in network health, we rallied around, okay, what's the biggest issue that we need to be addressing? And that is, how do we cover without liability or the co-pays, deductible, and co-insurance, the cost of the care, the cost of getting the test. And prior to any type of government mandate, it did come out that CMS and the Department of Health Services here in Wisconsin, the laws actually followed what the industry did, meaning we were out there right in front and saying, look, we're going to change our systems and we're going to cover testing at 100%. We're going to cover deductibles and co-insurance related to the services. So what I'm really proud of the industry is that we stepped up. We said, we're not going to create a barrier. The other thing that, we wanted to make sure that there was full access. When the health systems were reducing their access, and appropriately so that they could preserve personal protective equipment, so they could preserve and keep their environment safe for COVID patients to come in, there were some concerns about whether or not they could go and get a test. And so we made it available in and out of network. So a lot of changes there. Those were the immediate changes. The next immediate change that the industry and in network health had to make in particular is, how do we provide needed services outside of a clinic or hospital setting? Telehealth, big change. I will tell you that our telehealth numbers have increased 600%. Prior to COVID, we could barely give it away. Matter of fact, we couldn't. You could get telehealth services without any cost to you out of your plan, and we saw just, piddly numbers. What COVID did is it turned people to use their devices and their homes as places for healthcare services, behavioral health in particular. We've seen a huge increase and we'd seen that area climbing prior to COVID, but we've seen that drastically. As human beings, we crave connection with others, and COVID has really challenged that. It's challenged my employees as employees. It's challenged us as people. I think the number one thing that I hear from people is, I can't wait to be able to get out and be with people, and you're starting to see a little bit of that. But what it also drove the need for some additional support. So that's what I think in large part is driving some of these larger numbers on the behavioral health side. So I will tell you this, our industry is changing dramatically, because if you think about how insurance in general works, we look backwards to make predictions forward, right? And we look at, in the healthcare, we look at, okay, how much healthcare did someone utilize, and what were the conditions, and all those things to make basically a prediction on where we think costs are going to be forward. Well, we've had a 60% disruption in healthcare services so far, and it's a little unclear when people are going to feel comfortable, when healthcare is going to open up. You're going to see it slowly open up in the hospital settings, elective procedures, clinics opening up, but its success in opening up is going to be at the rate of basically comfort, if you will, in how patients are comfortable about going back to have those services. So in the insurance business, that creates a significant challenge for us, because we've got to try to predict based on very incomplete information. What does that mean going forward? And, my team, I have a talented group of actuaries, so I'm confident that they'll do a great job. But this is another place where being a provider-owned health insurance company serves us very well because we are very close. The relationships, we're working in lockstep with our owners to understand the changes that they're going to make and how we'll be able to predict what this means going forward.
And the follow-up, you talked a little bit about the workers and their changes. I think, how are you responding to what the worker is going to be going through? And just to let everybody know, if who doesn't know on this on Facebook Live and on Zoom, is that you guys made a really interesting decision for your office space on how it's like on a first floor, customer focused. It's not on the 10th floor of an office building as you'd think an insurance provider would be. It's just really interesting. When I walked up, I was like, whoa, this is kind of crazy. So, there's thought behind engaging with the customer, which I imagine, that project is kind of upended, it's upended itself right now. And in the future, there's going to be different precautions. But what about the worker? Like what are you guys going to do? How have you adapted? What do you think the future is going to be for your workers?
Yeah, one of the benefits of being a health insurance company is we employ some very talented physicians and nurses, and we're really letting them and asking them to lead us through this process of bringing our employees back into the office, because we want to make sure that we are doing it safely and that we are doing it in a way that protects them and protects their families. So we're letting the science, if you will, kind of lead us through that. Our approach will be phased, it will be deliberate, and it will be measured and flexible. And what I mean by that is we're going to be taking all of the precautions that you're hearing others. We're going to be, masking. We're going to be looking at social distancing. That will be a play. At Network Health, we're an organization that really loves to do engagements and meetings and collaborate. We're going to have to think through what will be different about that. I can tell you already that we're already going to set, kind of based on our different conferences, the maximum allowed and what does that look like when we have in-person meetings, setting those rules. Hand wash. We're going to put, like every other organization, but I will tell you, masks will be something that will be applicable when people are around. If they're in their office and their cube, not likely, but masks will be. And that's going to be a huge change, because I don't know if you've had the opportunity to wear a mask lately, but it is for people who are claustrophobic and don't really like that. It's going to be a huge change. And so getting people used to that and bringing them into that, it's going to be required. But until we have a vaccine, this is going to be required, and you're seeing it in other businesses. Matter of fact, I saw something recently that now people, what's the new etiquette when you're out, mask etiquette and the social distancing, that people are, more willing to call out. So we're going to be doing that like all other employers, but again, focusing on how do we do it in a safe way so that people feel comfortable at doing it. We do have about 100 employees that prior to this, over 3 years ago, we have a work from home. There are nurses and our case managers, our social workers. We will look at other departments and determine if it makes sense to even bring them back. We haven't made a decision on that, but there may be some departments that never come back into an office setting permanently that we'll keep them. So it's fluid. And again, our priority is the health and safety of our employees and their families.
Excellent. And if you do have questions for Coreen, you can use the question and answer box, and I will read those at the end or periodically if they kind of fit in with some of the other questions. I just did want to read some of the poll results because everybody has answered the questions. So from the first question was, what's your anxiety level about returning to work? 25% said 0, can't wait to be back. 69% said somewhat anxious. And that 6% said never going back, will always work from home. So a majority of the people want, and then the next question was, are you excited to return to work? Which is a question before that, what I'm doing now was always like, not really, but are you excited to return to work? 63% said yes, I miss the social community. And I think, as humans, we're social. We want to connect. There's something about that intangible about being around somebody that you can't really, the Zoom still doesn't do it, and things like that. And then 38% said, no, I'm used to working from home. Before this, I personally worked from home for 10 years. And, you do lose a lot of the conversations, and then you end up kind of just talking to the people, you never meet new people, and can be a strain on some of your creativity. And the last polling question was, where are you getting your information regarding COVID? And we had a few answers here, and I'll just kind of read through them here. One second. Let me just pull these up. So where you're getting information, we have 25% from the governor's daily conference, 31% from CNN or local affiliates, 31% from internet medical websites, and then 13% from the CDC. So just wanted to read some of those polling questions. Again, if you do have any questions, use the question and comment box. I'm going to continue. So going back to innovation and what's next, I really want to know kind of the one biggest challenge you are working on to solve at Network Health that you think would make the biggest single impact on the organization.
So, what we learned about this is that the home is a place where healthcare services were delivered during this, right, through telehealth. And we also, at Network Health, we serve a large population of Medicare. And so one of our biggest challenges is going to be is how do we transform that population into either the population themselves or bringing in the family to transform the delivery of service and get them, whether it's the equipment, the training, or whatever it takes for them to be able to feel comfortable. Because we do, in our world, there's a lot of information that we need to get from our members to make sure that we get paid according to their acuity. And right now, because they can't go into the physician's office and they can't talk to their physician face-to-face, and as for us to get that information, we are challenged. So we're going to rethink how some of those kind of wellness visits and other visits are going to be delivered with our owners. They're now poised in a much better position to deliver those services in an electronic manner. And our challenge will be to make sure that we're not disenfranchising anyone as it relates to being able to provide those services in the safety of their own home. So that's going to be some of our work. Again, we saw a big, huge increase, but what we don't know is how many people did not have access to the right technology to be able to have their home turned into a place of healthcare service.
What about just personally, what's the most important thing to your organization? I realize these are all kind of tied together, but I just wanted to get, maybe if you could slice these up a bit. The mission, the vision, or the values. Sometimes those can be jumbled together and we mistake them for one another. But what do you think is most important into driving an organization forward?
I think your values I think you can't live out your mission and your vision if you don't adhere to your values. And I've said this to my team and in our town halls. Values aren't some words on a wall. They're active. They're alive, and they have to be seen, not spoken. And what I mean by that, it's our actions. What we do and how we do it determines whether or not those values are living, breathing inside of our organization. Our values are what generates our ability to execute on our plans to realize our vision of the organization and to live out our mission. But one of the other things that when it comes to values is that we're all human beings, and we strive for excellence in how we live out our values, but we are flawed. And the other aspect of that I talk about is we strive for excellence, and when we miss, we practice forgiveness. Because, I personally do not want to be judged on my values on my worst day. I can tell you that. I mean, we all have them, right? It's like, Coreen isn't living out. And I have bad days, but the other aspect of it as part of our culture is how do we live out the aspect of forgiveness and asking for it and reparation. So, you're an organization that doesn't adhere to their values, in my opinion, will struggle with execution and will struggle with being successful. You may have, interim, you may have small, limited success, and you may think, well, we can deviate because look at this great win. But the longevity of an organization is significantly troubled when they don't have it. And for our company, we've been around for 35 years. We've had various different provider owners, but a strong focus on values. And I felt it as soon as I walked in the door. And my job is to make sure that I'm preserving the legacy of the work that was done prior to my taking the CEO job, and to continue that.
Awesome. And some of those values you mentioned earlier, like in the conversation around like belonging to network health, and belonging is something that NEWaukee is really passionate about. Like, how do you connect? How do you make people feel like you belong? And there's kind of a difference than just fitting in. I think sometimes we mistake belonging for like, oh, I fit in here. But
Yeah.
belonging really is about when people feel like they're invited, and they are invited, and how they connect to the mission. I think they'll stay longer at a company. They'll definitely attach themselves to other things if they feel like they belong there. And it's hard to do in companies. And I think that's one of the, it's not something that you put in an exit interview. Like, I didn't feel like I belong there, but it's really comes down to your decision. How do you, embed that inclusion and belonging into your culture?
So a great question. And I think it starts first with information. So one of the first things I did when I came to Network Health was we opened up the books. We this is how we're performing. And then why is that important? Because every single person has a role in improving. When I got there, we needed to do a turnaround. Good news is with 200% improvement on the bottom line, great work. And how we got there though was inclusion, because we needed every single person. So from our front desk receptionist to the C-suite, everybody knows where we are and what our goals are, what our strategies, what the financials are of the organization, how we are either meeting our plan or not meeting our plan, and then taking that information and helping everyone understand what's my role in making sure that we're successful. And we talk about that. The other part of it is to also celebrate the successes. And, we have one of the things I'm really proud of in our team, so there are efficiency igniters. We've made it everybody's job inside the organization to look for ways that we can improve the efficiency of the organization, because we have to be better every single day to be able to continue to compete with, the United Healthcares of the world, these big behemoth. And so everybody has a role to find out how do we identify waste, things that don't bring value to our members, and to figure out a way to do it better. And so, when everybody feels like they have a role and they have the information and the tools to be successful in their role, I believe, and actually it's more than just a belief, it's the financial results of where the organization is. It's manifested itself that way to say, we've got everybody that they're proud of the organization. They want to be a part of it. And what I hear, and this is, when other people outside the organization want to come in and work for us. I mean, I get on a consistent basis, I wish I had, there's a lot of talent out there and I don't have the ability to hire everybody, but what they're hearing in the community is that Network Health is a great place to work. They can bring their talents, they can showcase their talents, which I think is part of having the opportunity to be included. And then they can see the fruits of their labor in terms of what it means. And that's where, we have a dialogue, we talk about it, we show it, and everybody understands what their work means to delivering and executing on our plan.
Awesome. I'm going to take some questions now from the audience here. And one of the questions that I got twice was, what would you I guess, I think you said you were in the CEO role now for, is it 3 years or 4 years? I can't.
3.5.
Three and a half. Okay. Um, Going into that CEO role, what would you say is different now, or what would you tell yourself starting if you were to tell yourself, you're starting 3 years ago, what would you tell yourself?
Coreen, you don't have to have the answers. Surround yourself by really smart people and you'll figure it out as a team.
Awesome. Awesome. Another one here is, how are you, let me just kind of unpack this question. When it comes to the mental health side of things, how are you seeing any impact around mental health and people being isolated or, not being able to connect with others? Are you seeing an increase in maybe cases or claims or even people calling in around these services?
Great question. And what we have seen is in our telehealth, we track our visits between kind of physical and mental health separately. And the highest growth of our telehealth visits have been in the behavioral health and mental health sphere. So we know now, granted, I don't know for my employees, we do a lot of work around that. And I'll talk about that in a second, but for our members, we are absolutely seeing the toll that this level of isolation is taking on them, just simply because of what we're seeing in terms of the visits. Those I said overall is about 600%. I think we saw closer to 700% increase in our telehealth for mental health. With our employees, we do a lot to really check in. We do daily check-ins. We've got, I do some video, and others have done video messaging out to our employees to be able to say, we miss you, and get them building that that connectivity. So, it's one of the things I'm worried about, quite frankly, is I really care about my employees and making sure that all of their needs are met. I was on the phone this morning with the help desk and I'm like, first thing question is like, how are you doing? How are you managing this? She's an employee that's home with her dog. She doesn't have anybody else. And she's upbeat. She loves, gratefulness. I will say this, one of the things that at least I've experienced with our employees is how grateful they are that they have a job right now. Yeah. And so, we talk a lot inside the organization about being present and then also focusing on positivity. And I think that's helpful in this time.
Yeah, I've read I think yesterday I read that in Wisconsin alone, and I can't speak for the rest of the states, the hotline has seen an 891% increase in mental health questions around than in previous, which I think is just a staggering amount of increased calls since the spike in this.
I've always been a really positive person. I still am. I will tell you that I get my energy from people. And so just me personally having to go through this and deal with this, I've had to really kind of dig inside and find other ways to keep my energy. I love going into the office. I miss everybody it's just in an unbelievable way. And so really trying to focus on other areas to generate that positivity and keep that positive energy, I think it's been a challenge for others as well.
And I think that's our final question here is, based on the small unscientific survey we just did around, are you excited to return to work? You had 63% said, yes, I miss that social community. The question really is like, why do you think that is? Why do you think people want to get back in the office when, majority of people are like, well, I don't want to go back to the office. You'd think that would be the normal thing, right? But it's not. It's the opposite, actually.
Well, like I said, I think as human beings, generally, we crave camaraderie. We crave companionship with other people. And, if I've said this once, I've said it a million times pre-COVID, we spend more time with our work colleagues than we do with our family. And that's one of the reasons why I worked really hard to create a work environment that's family, a work family, because of the amount of time. Well, now we've all gone back and we've had to isolate to help protect the healthcare system, and we spent a lot of time with our family, and hopefully we've all been able to take advantage and look at the positivity that has come with being able to spend more time with our children, with our spouses, with our other loved ones. But I think we also crave variety. And that is the part, and that, and I miss hearing the stories. I miss, the hallway talks, just walking by and someone saying, hey, I did this, or I had this experience, or let me show you, I just got a new grandchild. I miss that incredibly, because we crave relationship. We want to be in relationship with others. And that's why I'm not surprised that, for those people who have been in a work setting, that they're looking to go back to that. I can tell you this, I'm not cut out for work from home. And for people who do it, I give them a ton of credit. Because I think you have to, there's a lot of self-motivation. I'm looking forward to getting back to the office. And what I would say is, it's also understandable that there's anxiety about doing that, because your environment will now be controlled by somebody else. So I can tell you this, I've talked to a lot of CEOs. We all want to create a safe environment for our employees, a trusted environment for our employees to come back to, so that they can share their talents, they can have that relationship with their colleagues, and they can do it in a productive way in this time space before we have a vaccine.
Yeah, I think that in-person stuff is just, sometimes you think about creativity and innovation, and it's you have processes in place, but it's not always planned or predictable, right? It's because of those side conversations. I always kind of say there's the other way is to brainstorm. There's always these forced brainstorming sessions sometimes in companies, and that's not always when people think of great ideas. Sometimes it's on a run, or it's social time, or it's even in the shower, or like it's these serendipitous moments that can be created by coming together, as opposed to right now it feels like creativity is on a time schedule of like 30-minute blocks in meetings that we're having. And that's that kind of stuff in person doesn't happen as much. Like you get some more free flowing time, even though you can be more productive at home. You don't have to commute and things like that. And I feel like those moments don't happen as much for me, unless, sometimes creativity and innovation comes from just being alone and isolated. That I agree with that too. But, sometimes it's listening to what someone says and going and applying it to what you do. So that's what I miss. I work, like I said, I worked at a home for about 10 years, maybe even a little longer. And I found myself getting into so many different conspiracy theories with all my time. I was like, and then I don't do that as much anymore. And I'm like, okay, this is a little more healthier not to look into UFOs, even though we just saw that news around the UFO thing. So. Anyways,
well,
go ahead.
No, I agree with everything. And I would say that's been interesting, because my world has been very task oriented, being at home, and less about those moments, like those serendipitous moments where you see a person, you see something, you have a problem that you've been trying to solve, and all of a sudden you see something outside of your regular environment, and there's the answer, right? It's our brain's ability to be kind of, calm enough to be able to think and find it. I look forward to those days. The one positive about this is I've had more time to work out in between, because, the commute is very quick, and absent being on camera, the prep time to office has also been reduced. So there's been that.
Yeah, totally. Well, thank you for your time, Coreen. This has been great. And I think let me just check to see if there's any more questions. There is not. Again, thank you for your time. This has been recorded so people can check it out if you came a little late, as some people did. But any parting advice you want to give to somebody before we cancel and close out?
The last thing I would just say is that this COVID-19 it's been devastating in many fronts, but through crisis can come innovation, can come new ideas, and also an appreciation for what we have versus what we don't. So take a moment, be present, think about all your blessings, and then also try to figure out what comes out of this in terms of the innovation that you could apply to your business or personal life, because there are opportunities that are there.
Awesome. That is great. That's great advice. I love it. So thank you. And thank you everybody for joining us. Again, go to NEWaukee.com. And we just so you know, there's been some chat to me saying great presentation, and we appreciate the advice. So thank you again. Talk soon.
Thank you. Thank you.
Cheers.